I don't know if it's working. Hey guys, can you hear me, or I can't see the live part of it, so mm. Okay, we will wait a few minutes for the notification to reach more people. So today we will discuss, I think, 5 topics. I got 5 questions or topics. The first one is about the difference between tretinoin and tazarotene, which is like a different generation of retinoids. The second question is stating does benzoyl peroxide works in cleansers or not. And the third one is going to be about using oils to deliver active versus like water toners or whatever. And the treatment for back acne, we will discuss this as well. And the last one is not really skincare related, but we will talk about it. This live stream session every week we will talk about skincare related or not skincare related subjects. So the last one is going to be about stress and education. A viewer on my Instagram reached out to me talking about having stress to achieve good marks or good grades and how to deal with that. So those are the main topics that I want to talk about, and I will start in a little bit until some people can join in. And I'm enjoying my like anti-anxiety stress relief tea. And you can tell I'm stressing. I got one friend here and one friend here and irritation all over my face. So I think I'll start with the question. The first question is tretinoin versus tazarotene. So both of those are retinoids. They are different generation. Tretinoin is the first generation retinoids, and tazarotene is third generation tretinoin. And they are both effective treatment for acne and other skin issues like hyperpigmentation. But there is only one review study suggesting that tazarotene is better for the open comedones and papules of the skin. For example, on the other hand, the tretinoin is equally effective for closed comedones. So tazarotene is good for open comedones and papules and papules, and the tretinoin is effective and equally effective for closed comedones. So they are both effective for acne treatment. Tazarotene may be more has a less side effect, so it is more tolerable between patient, but they are both effective, both amazing and effective treatment for acne and other inflammatory related skin issues. So you don't have to worry about it. The dermatologist will suggest to you which one will suit you better depending on the cost. Of course, tazarotene is more expensive than tretinoin, and other type of factors that can influence the decision that was made by your medical care provider. And the second question is, does benzoyl peroxide work in cleanser? There is a lot of misconception about actives in cleanser form. A lot of people say that you are just washing them away, they will not work. Some kind of active ingredients can have a deposit on the skin after a short time in contact time with your skin. So for example, salicylic acid was shown to have an effect in cleanser form. Benzoyl peroxide also showed that it has an effect on acne were in wash form. The studies and data are very minimal. Like they will not spend money on this kind of data. We know benzoyl peroxide can be effective for acne, and in washer form can also be effective. I found one article mentioning the two studies. One study did like looking for what kind of effect a 5% benzoyl peroxide on the skin, and they found that it was able to reduce the P. acnes bacteria, which is the bacteria that causes acne, reduced by 48%. And this was an old formulation, so it's not a very modern, the way the science advanced in formulation. It was a very old formulation, but it showed about 50% reduction in P. acnes bacterium. Or cutaneous bacterium acnes. And the second study that was suggested by the article is that they used 10% benzoyl peroxide 2 times a day and for 2 weeks, and the percentage of reduction was between 93% to 95% approximately of these bacteria that causes acne in general. So benzoyl peroxide in cleanser are effective, been used for years and years. There doesn't have to be a lot of data behind it, because we observed it working on a lot of people's skin. So it will work, and it is working, and a lot of people are enjoying those good effects of benzoyl peroxide on the skin. It also can provide an advantage compared to leave-on, because some people cannot tolerate leave-on because of the irritation, and benzoyl peroxide is kind of heavy on the skin. So the washing cleanser can be an amazing option for those kind of people. The next question is about the next question is a quite interesting question, is about oils versus like water-based to deliver active ingredients. So this kind of question is very interesting. So she was asking oils to deliver active ingredients versus water preparation like toners and this, etc. So oils can be a very, very, very simple carrier or vehicle for active ingredients. Active ingredients has to be, of course, oil soluble to work in this kind of formulation, because like I said, we only have oils doing the vehicle and carrier job. So, like for example, vitamin E can work, vitamin A, vitamin K, those for sure can work. Also, some, for example, derivative of vitamin C that can be oil soluble can work on those very simple formulation. It's just a mix of oils and carriers. That's it. Most of creams and lotion in the market right now is an emulsion. What emulsion mean is a mix of oil and water to have this creamy look, that lotion look, that milk look for some product. So you have to understand that no matter how they say oil free, okay, they don't have oil free, but they have oil soluble compounds in the emulsion, and they need to be dissolved in something that is more lipophilic. So oils can be, like I said, very simple, very effective carriers, but it depends on the active ingredients. If it's oil soluble, of course you can't just put vitamin C like L-ascorbic acid in oil and expect it to work. So those kind of things is very simple, like I said, can be effective, but it's very like minimal use. Not a lot of ingredients can be telling you, okay, we only have, for example, jojoba oil and vitamin E and sell it as a product. There is also this kind of product, but they are very, very limited. We don't see it in the market anymore because there is more effective delivery system like emulsion, encapsulation, and this type of delivery system and carriers. And the next question is back acne. Okay, back acne can be tricky to treat because back acne, like any other type of acne, is needs like a lot of attention to achieve a good results. Let me say it like this. So I can give you first about the results that why back acne can happen. So back acne can be caused by the same causes that happen in your for the acne on your face, irritation, inflammation, and stuff like this. So I can give you some tips to help you maybe alleviate those kind of factors that are causing the back acne. First of all, using some kind of heavy hair product like shampoo, conditioner, especially conditioner. And when you are trying to wash your hair, this product with the water can go on your back and cause some blockage for your pores. So I would suggest when you are washing your hair with a conditioner or shampoo to wash it in front, like tilt your head in front of you and let the water and shampoo goes in front of you, not in the back and not on your body. This will help a lot for some people. And of course, be aware of not getting this water or washing on your face, because it can also cause acne on your face. So try the best to wash it off your body and off your hair without touching your skin. The next tip would suggest is that after having a shower, to try to moisturize your back and where you are having acne as soon as possible, because a lot of people forget that when they are taking care of their skin, they only take care of the skin on the face, but in the body, we all have skin all over our body. So try and make sure that you moisturize after getting out of the shower as soon as you can. That will help with irritation and any issues with the dryness of the skin and inflammation that can lead to acne. Another tip that I can give you as well is to use the usual skincare product that you use on your face. Try to pick something that are not very expensive, because you have to cover a big area. So for example, like any benzoyl peroxide, 10% benzoyl peroxide, you can lather it on your back, shoulders, or your hands leave it for a few minutes and wash it off. This will also help a lot with controlling back acne and shoulder acne. I can give you also some salicylic sprays. Look for any salicylic spray with 2% salicylic, and after shower just spray it around the affected area, and this will help also a lot, because salicylic will help unclog your pores. It has anti-inflammatory effects, so if there is an active acne, it will calm down, reduce the inflammation and the redness and the pain. And lastly, I would suggest a product if you want to go on the fancier side. I think the company is called let me check. Zitstika, yes, Zitstika. That's a tongue twister. So this company recently launched, what is it called? Like a body wash for your body that deals with acne. They have the Fizz Mountain, I believe. They have two products for the body wash. One of them is called Fizz Mountain. It contains a lot of AHAs and salicylic acid and some type of very mild scrub. It will help a lot, I think, for looking at the ingredient and formulation. It will help you a lot with controlling the issue with back acne. Lastly, you can use the very basic, very minimal, very safe, let's say, and very mild scrubs to help unclog the pores in the affected area. And please don't use a scrub if you have an active acne happening right now. That can increase inflammation. We want to do it as a maintenance treatment. So after the acne is gone, we do a very gentle mild scrub on the back, shoulders, and the area affected by acne, and that will help a lot with controlling acne. So those are my what is it called, my advice for treating with back acne. And yeah, those are like I said, make sure that your hair product don't go in on your skin where the affected area, or your face that can block because most of the shampoos and conditioners have very heavy oils to hide or moisturize the hair, hydrate the hair, keep hydration in the hair. So those are not very suitable for the face. So, and the last question, which is not very skincare related, is that dealing with the stress and how to manage time also between university and normal life, how to stop stressing about grades, because I'm stressing about grades and I'm not getting good grades. So this is a very close to home, let's say, issue, because I usually get stressed a lot about exam, university. I'm currently having an exam in 2 days and I'm stressing a lot, as you can see here, the acne. But I try my best to say it's not the end of the world. Like if you did not did like if you did not do good on those exams, it's not the end of the world. You can always try next semester or whatever. Try to make the grades not the goal, but as a side product. So how I made this, how I helped myself a little bit. I'm not saying that I'm okay, I'm stress free, I get good grades all the time. No. You have to try to make learning, the process of learning as your goal, improvement as your goal, and the grades or good grades or whatever grades you want will come as a side effect of this process. And it is the best way that I've tried and made myself understand that good grades are not the goal, but learning and improvement and making sure that you are learning something new that you didn't know yesterday from today's lecture. That is the best way you can deal with stress. You can deal with good marks that you want. You can deal with anything that you set your goals in life. Like, okay, my goals are to improve, to be a better person each day by day, and you will notice that your grade will get better, because the exam, the assignment, the homework are all designed to make sure that you understand the subject that you are taking with the university. So if you had an exam about biology and you try to memorize everything about biology, most of exams in good education system in countries are made to make sure that you understand things, to evaluate you, to assess you, to make sure that, okay, you understand the main pillars of a certain subject, and you can like pass the exam easily. So if you are trying to focus more, okay, I need to memorize everything, I need to understand everything, I need to know every small detail or whatever, you will get lost, you will get exhausted, you will get burned out before reaching the date of the exam. So just make sure that improving and learning and enjoy the process, to make sure that, okay, I'm trying my best to be a better person, and trust me, good result will come after this. So don't make your good result as a goal, make it as a side effect product of the process of learning and improvement. So that would be my advice. For time management, try your best to assign specific time for studying, assign specific time for whatever, eating, any activity other than studying, but make sure that you respect the time for study. Okay, I have to study 3 hours a day. You make sure that 3 hours a day are filled with studying and learning. And those are my advice. Dealing with the stress, you can try whatever makes you happy. Do it for an hour or two a day to help relieve the stress. I depends, like you see every live videos, if you are following my old lives, I always drink herbal tea to help me calm down, chamomile tea, green tea, whatever tea, ginger, anything that help me calm down, anything warm that help me to slow down. Okay, everything is fine. And you will do amazing yoga, exercise, whatever makes you happy and release the extra stress and tension inside of you will be amazing as a tip to reduce stress. So guys, those are my questions. So if you have any question, please let me know in the comment, because I can't see the live chat. I don't know why. So if you have anything related to skincare or not, as you can see, my last question was not related to skincare, you can ask me. And those were the 5 questions that I received related to skincare. Like they were 4 related to skincare, 1 related to general advice in life. Because if there is no question, I will end the live early today. In like 1 minute, I will end it if I didn't receive any question. So please let me know if there is any question. So I'm trying to make this live session thing on weekly basis because it's a fun way to connect with you guys and answer your question, have a discussion. My last live, I had like a fun discussion in the comment about azelaic acid, and if you have, like I said, any question, leave it in the comments or in the live chat, because I don't know why I can't see the live chat. It's my 4th episode and I'm still struggling with the live chat settings and everything related to it. So I will end the live in like 1 minute. So if you have any question, please let me know before ending it, because last time after ending the live, I got like 4 questions or 4 topics, and I was like, okay, I will add them to the next live session, which I did, of course. So if you have, I will give you like 1 minute or 2 to give me your topic, your question, or whatever. Oh, okay, so the live chat is working. Okay. Thank you, Susu. Yes, I need the good luck because my exam is going to be a heavy one. Okay, so it's look like there is no question, so I will see you guys next week. So for the videos, I hopefully after the 20th of October, we are on the 17th, so hopefully after the 20th I will able to film the La Roche-Posay one. After that I will be over with the Botox in a bottle, the Argireline, and the other product, I forgot the name, from the Ordinary, to test if it's helping. I stopped the tretinoin and we will see the result. I took a picture every 10 days for the Botox in a bottle, and we will see if truly the Argireline and Matrixyl 3000 will help to alleviate the wrinkle. So see you guys next week, same time. Maybe I will do another poll to make sure the time is perfect. And please be safe, take your vaccination, of course, and wear your mask. We are not over with the COVID situation, but hopefully soon we will be able to get over the situation. And be safe, please, and see you next week. Bye.